Hello, everyone, and welcome to Dr. Scott Answers, our biweekly segment that we are doing here with Dr. Scott McMahon, our medical director here at MOCO. I am Allie D'Amico, one of MOCO's nurse practitioners and our director of clinical operations. So what we do here at Dr. Scott Answers is we take questions from Reddit in regards to mold toxicity, and we have Dr. Scott, our leading expert, answer these. So how are you doing, Dr. Scott?
I'm great, Allie. Thanks for having me. Happy holidays. I know that's kind of timely. I see you're dressed as an elf today.
I
Oh,
am.
that's going to get edited out, I know. But yeah, thank you. And as you know, I'm the medical director at MOLCO, and I've been working with patients with mold toxicity for, at this point, almost 16 years. And I'm excited to answer some questions.
Awesome. So let's jump right into it. Okay, our first question is a very great one, very interesting, and let's go ahead and read it. So, does anyone else think mold could explain a lot of haunted house stories? Random thought while I was sitting in my moldy flat. I've been dealing with so many symptoms: extreme depression, anxiety, OCD, brain fog, nervous zaps, stomach problems. The list just keeps going. I was thinking about how you always hear stories about people moving into old houses and suddenly experiencing ghosts or paranormal stuff. And honestly, I can't stop thinking that a lot of those cases might just be people getting messed up by mold. Think about it. Old houses equal hidden mold. My mental health is so bad right now that I wouldn't even be shocked if I started seeing or hearing weird things too. Mold has given me the worst OCD. I have daily fears about schizophrenia and hearing voices. So very, very interesting thought. I'd love to get your opinion on.
Well, that's a really fascinating question and kind of a timely one, too. There are some people believe that an apparition comes down the chimney this time of year and leaves presents for people all over the world. I don't know if that's true or not. I think that there are a number of ways to answer that question. Some people actually believe in ghosts, and there are people that research the paranormal and whatnot. Some religions believe in spirits that still roam the earth. But getting down specifically to the mold question, assuming that you're not using shrooms or some sort of psychedelic that might make you hallucinate, if we're just focusing on mold toxicity, yeah, it could do that. I once spoke with a Johns Hopkins and Harvard trained psychiatrist who was a brilliant woman. And I asked her, she was a psychiatrist, and I asked her what kinds of psychiatric illnesses or mental health problems could exposure to mold and inflammation in the brain specifically, could that cause somebody? And she said, every single possible mental health issue. And so I said, like schizophrenia? She said, yes. Depression? Yes. PTSD? Yes. Bipolar disease? Yes. So within that realm, you certainly could have hallucinations. You could have paranoia. If you already have underlying mental health issues, it could exacerbate those. If you patients who never had problems with mental health, we've seen the development of depression and anxiety, panic attacks, you name it, we see it. And I've seen hallucinations too, both vocal, where you're hearing voices, and also visual, where you're seeing them. The latter is less common, but definitely have seen those kind of things happen. And for our question writer, I would say it's important for you to get your house tested and seek treatment with somebody who's mold knowledgeable, and make sure that that's not the problem. And if it is, to make sure you get the treatment that's necessary to hopefully turn the tide back the other direction.
Yeah. Yeah, I can imagine how someone like this who I don't know this person's mental health history, but if say they didn't have a mental health history and has been going along just fine, and now all of a sudden out of nowhere, extreme depression, anxiety, OCD, depending on the age, that stuff might not typically come out of nowhere. We do know a lot of mental health problems and schizophrenia do develop in especially for men, later in the 20s, early 30s as far as an age range, but it usually typically doesn't just come on in the setting of being in a moldy environment. So yeah, I think getting both things checked out would be a great idea for this
Absolutely.
person.
It's interesting. They only know of one biomarker that is consistent with people who develop schizophrenia, and that's an elevated C4A, which is
Mm.
also a marker of mold toxicity. We knew that 15 years ago. This is a recent understanding in the mental health field. But inflammation in the brain can cause any mental illness. And like you said, not only do you need to be checked for the mental illness, or I'm sorry, for mold toxicity, but you probably should be evaluated by somebody skilled at treating mental illnesses too, at least until, well, just start there.
All right, let's see our next question here. A very common one regarding the good old MARCoNS. Okay, is the MARCoNS swab necessary? Are there strong arguments or experiences to share against not testing at the start and doing the biofilm clear protocol and saving the test for when you think it's cleared to confirm? So I think what they're asking is, what is your argument against not testing if you think this person should be testing if they're not getting well by now? Is, I think, the basic gist of this question. What do you think about that?
That's a really great question. And certainly when I was in private practice and I was seeing mold patients from around the country, if they came to my office and I wanted to screen or had any question about MARCoNS, I would just do the test myself. It takes about 6 seconds. You have a swab that's this long, that's about 6 inches, and you actually put that in the nose going parallel to the floor all the way back till you almost touch the brain. There's a small, thin bone between the back of the nose and the beginning of the brain, and you go all the way back. So think COVID swab, only worse. And I could do it in about 6 seconds, and it was uncomfortable, but not horrible, and it was bad. However, for my telehealth patients, if they wanted to get a MARCoNS swab, they would have to do that on themselves. And many people couldn't tolerate that kind of nasal trauma and that kind of discomfort that was going on. Or they could take their MARCoNS swab to their local doctor, and some doctors would do it and others wouldn't. Or they could go to the ear, nose, and throat doctor, and the ear, nose, and throat doctors, the ENTs, would always do it because they're trained on how to do that. So those were the logistical issues that we had with getting MARCoNS swabs on everybody. Now, when you are looking at MoldCo and what we're doing, everything we do is telehealth. And so if you think about that more difficult case where you have to go and find a doctor, find somebody to do this, it could take weeks for you to actually get the MARCoNS swab. And that creates a big delay in your care while you're trying to organize that. A lot of our patients have brain fog, and this just becomes overwhelming for them, and it never gets done. So since we know that about 80% of adults who develop mold toxicity will have MARCoNS in their nose, we've made the decision that it's better to just go ahead and treat and expect that you'll get better without going through the difficulty of doing the swabs. And that's why we do it this way. You know, if everybody from Molco came into our office, we would probably swab everybody, but we're not doing it that way. And it just becomes an onerous task for our individual patients. Now, having said that, you mentioned that you have all the symptoms of MARCoNS, and they could be as simple as having a lot of congestion, or very commonly amongst mold toxicity patients, they're congested all the time. And it's not just seasonal, like, you know, certain types of pollen are out or whatnot. It's like all year long, every day, they are congested and stuffed up. Maybe they have headaches, maybe they have sinus pressure, they can get sinus infections. I'm gonna give you a tip here. It doesn't have anything to do with whether you have fungus colonizing in your nose, because 98% of Americans, healthy, not healthy, 98% have fungus colonizing their nose. It is a normal finding. But some people will put you on antifungal medicines for that, you know, and sometimes for long periods of time. I wouldn't do that. And in fact, if a doctor suggested that to me, I probably would go find somebody who knows more about mold toxicity. But testing is fine. And if you're the kind of person that wants that evidence that the MARCoNS is there, we can arrange for you to get or we can show you how to get the MARCoNS test, and then it's kind of up to you to get the testing done, send it in. We can review the results with you and tell you if it's MARCoNS, and obviously we can treat MARCoNS too.
And what do you say to those patients who come to us and they say, you know, these MARCoNS symptoms are my biggest complaint. This sinus congestion, this pressure in my face, this constant postnasal drip. I actually want to start with the Moco Clear or your Biofilm Clear or your EDTA nasal spray, first, because that's my most bothersome symptom and that's what's bothering me. So I want to start with that while I'm starting the binders or before I start the binders, that because this is my most bothersome symptom.
Right. Yeah, another great question. So, when Dr. Shoemaker first developed the Shoemaker protocol for treating chronic inflammatory response syndrome, mold toxicity, what he found was that if you treated the MARCoNS first, people didn't get better. If you treated the MARCoNS and used a binder at the same time, started them at the same time, people didn't get better. But if you started the binder first and about a month later started the treatment for the MARCoNS, that's where they got a lot of improvement. And so we follow that same kind of path. We start with a binder and then we move to the treatment for MARCoNS, and then we move to the VIP kind of in that same order that Dr. Shoemaker did it. And he had tremendous success that he published. I've had tremendous success in my office using that same kind of the same directionality of the protocol. And that's why we do that at MoldCo. I would also throw in, though, that if you're having a lot of symptoms, mold may be the cause. And if you have mold growing in your house or your workplace, that exposure can cause that congestion. It can do it directly. It can do it through mold toxicity. It can do it through allergies. There are a number of different pathways where you can get that congestion. But there are other things too. For instance, you could have a chronic sinusitis that is caused by bacteria that really needs antibiotics to take care of it. You could have a chronic fungal rhinosinusitis that actually does need antifungals. But again, it requires somebody who's skilled in making that diagnosis to actually look in your nose. So if that is your primary symptom, definitely should look at mold toxicity as the pathway that might be causing it. But knowing that there are other things that could cause it, you probably should see your primary care physician or an ear, nose, and throat doctor to make sure it's not something else. One other thing that we rarely see, but it does happen, is you can get a fungus ball where you've actually, in one of your sinuses or nearby, you've actually got a ball of fungus, like a big fungal growing in there. And that requires specialized treatment. And it requires a CT scan or an MRI to find it. So it really does make sense, if this is your primary problem, to not only follow the mold toxicity path, but also to follow the specialist path that looks at your ear, nose, and throat.
Yeah, super helpful. Awesome. All right. And then if we move on to our final question here, the classic brain fog we're seeing. Anyone else dealing with sporadic stuttering, brain fog, out of breath, and headaches? I had to quickly move to this bottom floor level apartment, and I was fine for the first month, but the last 3 months have been harsh, related to possibly toxic mold. I'm not sure what mold it is, though. I've been noticing a weird random moments of stuttering while talking, and the other symptoms is mentioned in the title. And I'm curious if this is common. So what are the common symptoms that people start experiencing when they do have that light bulb moment of this mold?
Yeah, that's a really good set of questions. And I'll start by saying, yes, mold toxicity, mold exposure can cause all of those symptoms. And I'll come back to that. The next thing I want to talk about is toxic mold. That's something that is a kind of a layperson's term. I don't really ever talk about toxic mold or toxic black mold. There are a whole bunch of potential meanings for that. When Stachybotrys came out maybe 10, 15 years ago as a potential for causing problems with babies and causing problems with other people, and we knew that Stachybotrys could make toxins, people started calling it toxic black mold, specifically for Stachybotrys chartarum. And again, mycologists don't do that. People in the know regarding mold toxicity, we don't call it that. From my point of view, all mold that's growing in your house can be toxic to you, whether it's capable of making toxins or not, because it triggers, particularly if you have the genetic predisposition, that mold exposure triggers an immune response, not a toxic response, but an immune response that leads to all sorts of problems in your body. And there may be toxic responses going on also. All of that is what we sum up and call mold toxicity because it's causing problems in your body. Toxin actually means like a poison. And what we're presuming here is when you are in a moldy environment, it can become toxic to your body. And that's the way we use the idea of mold toxicity. And other people may use it other ways, but that's the way that the doctors and other providers in the know are using the terms mold toxicity. Now, going then into your symptoms, there are a number of things, particularly if you're genetically predisposed, which is 1 out of every 4 people. There are a number of different ways that mold toxicity can affect your brain and cause other symptoms. So we know that just regular mold exposure for people that don't have a genetic predisposition can cause headaches and can lead to respiratory problems. It can trigger asthma. It can cause asthma. And all those things can make you short of breath. So there's a couple of symptoms, but mold toxicity takes those to a different level. Mold toxicity can make you feel like you have emphysema or COPD, and it can even be confused with COPD, chronic obstructive pulmonary disease, can be confused with that by pulmonologists who don't look at for the cause. And so you see somebody who's never smoked in their life and they have COPD. It's like, how did that happen? Well, mold toxicity. And then beyond that, mold can cause problems with your brain through several different pathways. One way is that it helps, or it not helps, it causes a reduction in blood flow to the distal or far away parts of your body. The farther you get away from your heart, the more it can obstruct the blood flow because the blood vessels get smaller. And so it's harder for the red blood cells carrying oxygen to get to your cells. And that creates metabolic problems the farther you get away from your heart. So you can get cold hands or cold feet or cramping or pains. But your brain is also considered far away from your heart. And so you can get a reduced amount of blood flow going to your brain. And Dr. Shoemaker proved this at this point almost 20 years ago. He was doing MR spectroscopy, and he found that there were areas of the brain that were getting less blood flow than other areas of the brain. And we call that capillary hypoperfusion. Hypoperfusion meaning the amount of blood that you're actually getting to the cells, to the tissues. So that's one mechanism, is not getting adequate blood flow, which then means that you can't make adequate amounts of energy in your cells, and the cells around there underperform. So one reason for brain fog. Another has to do with the blood-brain barrier. Now, in most of your body, your arteries carry blood to all the tissues. And I always thought about those arteries as like being a garden hose, like the water came in one end and it went out the other and everything was great. But that's really not the way most of the arteries in our body are. Most of our arteries actually are kind of leaky. They're more like a soaker hose. And fluid and small proteins and whatnot can actually leak out of the arteries and go into your tissues. And the tissues don't mind, and there are mechanisms to clean that up. And maybe it's like an extra snack for your cells. But the brain doesn't want all that stuff oozing and leaking into it. And so by 5 days of life, a newborn baby will have extensions of nerve cells from their brain going into the arteries and kind of plugging the holes. It's what we call tight junctions. And instead of having loose junctions where stuff can leak out, you have tight junctions. And we call those arteries with the tight junctions the blood-brain barrier. It keeps junk and toxins and other chemicals that the brain doesn't want from just oozing into the brain, because the brain is really sensitive material. And so you have a blood-brain barrier, and chemicals like VIP and vascular endothelial growth factor maintain the tightness of those. But most of our patients have a low level of VIP if it's measured. And most of our patients have a low level of vascular endothelial growth factor, or VEGF. And so the chemicals that are trying to maintain the integrity of your blood-brain barrier and then we also know that elevated levels of TGF-beta1, MMP9, and C4A, they can all degrade the blood-brain barrier. So what happens when you have mold toxicity and you have these abnormalities of these chemicals, low in the ones that maintain the integrity, high in the ones that destroy the integrity, they can actually create openings, breaches where large chemicals and even cells can go into your brain. Or they can make smaller areas where the blood-brain barrier is more porous than it usually is. And maybe inflammatory cells can't go in, but the cytokines can go in. And other scientists have shown that if the cytokines go into your brain, it creates inflammation. So you have an inflammatory process going on in your brain, and that's bad. We call that encephalitis, or that you have an encephalopathy. And in this case, we call it a toxic encephalopathy because immune system abnormalities in your body that normally couldn't get into the brain, they get into the brain and they create inflammation all over your brain. And that can recreate the stuttering, the brain fog, other kind of neurologic issues all throughout the body. And that's what's special about mold toxicity is it can really affect any aspect of your neurological system.
I know people watching might be like, "Oh my gosh, I am having brain fog because I have these toxic chemicals causing inflammation in our brain." But, we do find, or can you confirm, through the research that's been done with the Shoemaker protocol and with, I know you've treated thousands of patients yourself. Do you find that following a protocol, treating your mold toxicity, re-regulating this immune system dysregularity that we find with our mold toxicity patients, do you find those synapses, the blood-brain barrier synapses, getting tighter? Do you find these symptoms getting better? Do you find these lab irregularities getting better with treatment with the Shoemaker protocol?
Absolutely. And that's the good news. I mean, that's actually great news that you can recover, I'll say most, but maybe even all of your cognitive ability as you get treated for mold toxicity.
Okay.
So most of your memory, a short-term memory in particular, can start to come back. Your ability to focus and do executive functioning can improve dramatically if you, number one, get out of your bad environment and take a binder and treat MARCoNS if they're there. And finally, with VIP, helps bring the inflammation back down to normal. That's its primary job. Most of our patients are low on that measure. Historically, in my practice, about 80% of adults are low in VIP when I first see them. And so we can help do all the things that VIP do, which is basically balance out your immune system and bring those elevated cytokines back down to normal or close to normal. So that will turn off the inflammation that's going on in your brain. That can help rebuild the blood-brain barrier. That can help reduce the systemic inflammation that you're having. I mean, it's just a win-win-win following the protocol that we have at Mall.
So, if people are watching this or listening to this or dealing with these issues, what do you suggest their next steps are as far as looking into getting treatment?
Well, I think the best place to start is to go to moldco.com and see if you're living in one of the states that we're currently treating. I believe we're in 14 states now. Within the next 3 months or so, we're hoping to be in all 50 states. We have provider who are licensed in all 50 states. We're just going through the motions of building up our staff so that we can meet the need of all you patients that are out there. At moldco.com, if you're wondering if you have mold toxicity, you can get labs without seeing a provider and an interpretation of those labs also that can either kind of rule out the idea of mold toxicity or say, hey, I've got some objective information that says that I might have mold toxicity. We have providers that are trained who can take your symptoms that you can put in the portal. You can fill out a survey of different symptoms that are consistent with mold toxicity, and we can help decide if you are likely to have mold toxicity or not. And if you do have mold toxicity, or it's likely that you have mold toxicity, we have a treatment protocol that has been tested and shown to be effective for people with mold toxicity for, at this point, over 20 years and tens of thousands of patients. So there definitely is coming back from this illness. It requires you taking care of your environment. It requires you taking some medication for a time, but you can reverse or nearly reverse a lifetime of damage in just a few months if you follow the mold cult protocol.
Excellent. Well, I think we're at time here, but that was really helpful and informative. And I'm looking forward to the next time we do Dr. Scott Asks. So thanks for joining us.